We are all animals, and we, the Homo sapiens, are the ninth evolved species in the human family. Hope you know that Homo sapiens means the wise man. Homo simply means human. Okay, so we are the ninth evolved in the human family, so we are not the only one that existed as humans. We had other humans that existed, like the Homo habilis, that is the handyman. We have the Homo rudolfensis, the larger man. We had the Homo erectus, that was the upright man and the first known human to migrate out of Africa. We had the Homo antecessor, the pioneer man. We also had the Homo naledi from South Africa, and we had the Homo neanderthals. Okay, the Neanderthals were also known as the humans that were timid and unwise. However, they had sophisticated technology and they even existed up to 40,000 years ago. Okay, they had their strong, sophisticated building, their cooking, their adhesive that they made. They were into weaving, they made some clothing for themselves, they did seafaring in the Mediterranean Sea, and they also produced or grew some medicinal plants that they used in treating severe injuries. Yes, you may think they do not have much ambitions, however, they had more peace. Yes, they had medicinal plants that they grew then to treat severe injuries. That is medicine. Now let us talk about medicine proper. Medicine is a noble profession which involves human medicine and veterinary medicine. There are different units in this medical profession, although the human medicine just takes care of only the Homo sapiens, that is the modern human within the hominines, while veterinary medicine takes care of other primates and other animals like those of the canines, the felines, the porcines, the equines, and the avians, etc. In the medical profession, there is a global practice of ensuring that before you practice as a medical practitioner in a country, you will have to be issued a license in the country. So it is easier for people who studied and graduated from the School of Medicine or their well-known bodies in the country where they are practicing. However, any doctor who schooled and obtained his or her certificate from a foreign university or college anywhere outside their country will be meant to write an examination before you'll be allowed to practice in the country where you are going to. For instance, like Nigeria, any doctor who schooled outside Nigeria will be allowed to practice in Nigeria only after sitting for the council examination. Like I said, it is a global practice. If you train in a particular jurisdiction and you want to go to another jurisdiction, you will be subjected to be assessed by those other jurisdictions, even if you're a professor. Example, Nigerian doctors will likely write a council examination in any country that they choose to practice before they'll be issued a practicing license. In Nigeria, the council examination is prepared exclusively for foreign trained doctors who, once they pass, will first be issued with a provisional license. Then they will go for housemanship, which means that they will be sent to a particular hospital that is fully accredited and they will be supervised by a physician. This is mainly for graduates, those who recently graduated from a university overseas. Okay, but overall, even if you're practicing overseas and you've graduated a long time ago, you'll be required to sit for a council exam in Nigeria before you will be granted your license when you pass. This examination is scheduled twice in a year, so it depends on when you want to write. However, recently, a lot of foreign doctors fail these examinations. in the past years like 2021, 2022, you will realize that more than half of those who sat for the exams failed. And you know that without it, you will not be able to get your license. This year, around July, an examination was written at the University College Hospital in Ibadan, or your state. And only 205 doctors passed. And about 529 foreign trained medical and dental graduates failed. We are talking about only 27.9% pass here. So the success rate is just about 28%. This November, another examination took place and there was mass failure. About 433 out of the 836 foreign trained medical graduates who sat for the qualifying examination failed. This doesn't look good at all. Most foreign trained doctors complained that the Medical Council of Nigeria deliberately failed them. However, the council denied all the claims. There was even a huge case in 2017 where such mass failure was recorded and there was a receipt. And about 309 students sat for the receipt and only 51 scaled through. Okay, so the council and many Nigerian trained doctors believe that a huge number of the foreign trained doctors study in substandard schools. However, the doctors said no, that the council deliberately frustrated them. Some Nigerian doctors who had interacted with some of these foreign graduates said that they lacked exposure, which is very crucial in medical training. Also, that some medical schools abroad lacked a well-structured medical curriculum like we have here in Nigeria. So the Medical Council is urging Nigerians that those sponsoring their children overseas to study medicine should please look or seek the guidance of NUC, that is the National University Commission, and the MDCN as to which medical or dental schools abroad are considered good standard. The registrar and the executives of the MDCN also insist that the assessment examination is necessary because we cannot put the health of Nigerians in jeopardy. It is better we have a few doctors than have doctors that will put the health of Nigerians in danger, and that all hands must be on deck to put this country in the right place. As for me, I kindly plead to differ from this. Every Nigerian who is watching my content here on YouTube knows how difficult it is to get admission to study medicine in Nigeria. It is very difficult, and that is why some parents decided to send their children abroad. Some of these children even had to obtain some scholarship to assist them in paying their school fees over there. However, Nigeria does not really appreciate certificates acquired from foreign universities, and the medical examination is a global one. As for those that got admitted, after subjecting Nigerian medical graduates to all the strong curriculum, passing them through thorough medical training with their hard work and resilience, they will graduate, attached to clinics for their housemanship for 1 year, and after that they will serve their nation for another 1 year. That is 8 long years. Then what next? Where is the provision that you created for them to contribute their quota to the Nigerian society? No, sir, we do not have few doctors. We have many doctors. Some of them left to countries who needed their services, and in turn, they will better the societies of these people. These doctors do not need to sit for and write any examinations as they schooled and graduated from Nigerian universities. They already have their license, but no job to cater for their needs as they deserved after their hard work. Nigerian government should please do better. Most of my colleagues have traveled out to the Western world and they are making it big. Now let's come back to the council examination and the mass failure. I want to talk to foreign trained doctors who wish to write this examination. There is no need to fear or banter because you must pass this exam before you get your license to practice in Nigeria. How do we resolve this? First, to write this examination, you have to prepare yourself first emotionally or mentally, second academically, and again you have to prepare yourself spiritually. For the emotional or the mental preparation, it means that you should try to stay focused. Rid yourself of any personal trauma or attachment that is negative or that will affect you negatively. Okay? Ask yourself, do I really want to pass this examination? What do I have in store for me after this examination? Prepare yourself first before you register for this exam. Second, academically prepare. That is what we call the complexity issues. Some doctors or some graduates outside Nigeria who did not really have any connection with Nigerian university education system may be surprised when they come back to write this examination. Some of you failed the exams even before you entered the hall for the examination. Remove that mindset that, oh, this is Nigeria, this is Africa. After all, I studied in the West, so I'll be better off. Or is it not just medicine? No, sweetheart, you may be surprised. Push your ego aside. Push your fear aside and learn how the Nigerian medical system works. School here is 6 years, plus internship and youth service. That is 8 years. So, first, there are differences in the African and the Western region. The Western region are mostly temperate, while Africa is a tropical region. So we are in the tropics, and as such, there are diseases that are prevalent in these regions, hence different drugs used. For example, malaria is endemic in most African countries, while those in America and some European countries are alien to it. Another one, in Nigeria, the system is tough like every other African nation. Hence, you should think outside the box. Your ability to critically analyze a case based on the history and the clinical science provided, then draw your differential and your tentative diagnosis via the pathognomonic science, proceed to collect appropriate sample, either tissue samples, blood sample for CBP, urine for urinalysis, and further sensitivity tests, X-ray, etc. Then commencing treatments, a tentative treatment, by the way, with the adequate drugs during emergency while waiting for the result for confirmative diagnosis, and to further change your medication or become intensive is what makes you a professional doctor. All cases present each symptoms, and each symptom have drugs to combat them via its pharmacodynamics or kinetics. So attach yourself to professionals and doctors who have the capability of teaching you to learn more about practical approach in medicine. Do not rush to write council exam. Take it slow. You should have a practical experience in the Nigerian clinics or hospitals first before you go for the examination. Another point is attend tutorials. Please look for medical centers that specifically groom doctors for council examination. The essence of the tutorial is to guide you through the known steps of the examination. It does not mean that all the questions that you were taught or all the things you were taught in your tutorials will come out in your medical examination. No, please remove that mindset. You are a doctor. Kindly broaden your horizon. Okay? Also, study in groups. This will help you to assess each other and in turn personally develop yourself the more. You are not just practicing for the examination, you are also practicing for the future. While in school, you will write practical exams, viva, whereby you'll be placed in stations. Some may have 10 or 20 stations, and each station you'll be given 2 to 5 minutes to answer. Some stations are oral, some written, and you move from one station to another once you hear the bell. I passed through that same system from my 200 level up through my 600 level, followed by viva, which is the oral examinations, where you are drilled educationally by a professor. At every professional level in the school, you will write a theory, which includes the OBJ, subjective, essay, practical, and then oral. Council examination is a 2-day exam. The first day is your CBT and the second day is your structural clinical examination, where you answer questions from one station to another. The next is spiritual preparation, which is very important. In Nigeria, we all believe in something. You may be different, but I believe in God. So I will advise you to pray against every obstacle that will obstruct your path, like negative thoughts, omen, anything that will obstruct you. Let them be cleared out your way. Believe in whom you are, walk into the examination hall and write the exams. Even if you did not pass it the first time, it doesn't make you less of a doctor. It simply means that you should try a second time, and I tell you, you are coming back stronger, better, and more exposed. Okay? Always try your best.